We continue with our conversation on the International Day of Care and Support. The world marks this day to observe and really have conversations around the critical input of care workers globally. And to continue our conversation, I'll start with you, Odi, in terms of Narok County and just putting the lens on this particular county that is hosting us this evening. When we talk about GBV, and we've had a lived experience here talk about how harsh things can get for the women care workers in this community, what safeguards should be strengthened to ensure that these workers are kept safe? And when we talk about GBV, how extreme, if at all, a situation is it in this particular county?
Thank you, Lillian. When it comes to GBV, first, allow me to recognize the fact that some of the drivers of GBV within Narok County are the normalization and socialization, pegged on culture and to some extent religious beliefs. So with that recognition in hand, then we realize that the proportions of women the vulnerable women who undergo GBV, whether it's intimate partner violence, when it comes to adolescent girls, and we have FGM manifestation, and it takes different forms in Narok County. When it comes to teen pregnancy, which is also a form of GBV, because then it results into any intercourse with a minor, then it's a form, anybody under the age of 18. Then we look at currently national statistics, we are working at 28%, still very high. And when we look at the crude data through our Kenya Health Information System, we are still we still have 2 more quarters to go, but we are at 1 more quarter to go, and we're still recording 24-point-something%. That means that as we go into the festive season, then we are looking forward to seeing more of the manifestation of this. But then we look at why does this happen? A lot of what happens when it comes to GBV, like I mentioned, it's the normalization and women wanting to really maintain the community unit as it is. And those are some of the questions that we need to look at. How can we support ourselves when it comes to what are the low-hanging fruits? We want to look into alternative rites of passage for FGM. We want to look at empowerment avenues when it comes to women and gender issues, so that we're able to put them across within a patriarchal society that we live in. And Masa is just one of the living patriarchal societies within Kenya. But we recognize that across the African communities, there is heavy presence of patriarchy, and it also drives our cultural beliefs and practice, and also our attitudes across GBV. So what are some of the safeguards we are looking into? We want to look at an enabling policy environment, a legislative environment where even as civil society organizations, we are looking at, are we able to have an environment where we are able to have policies that ensure that there are safeguards around women when it comes to prevention? Do we have the duty bearers? Do we have a multi-sectoral approach to preventing GBV? When we look at access to quality of essential services, because then it's just not enough for us to be able to give the services. But the services we are giving must be able to be accessible to the women that we're looking in, not just within Narok, but even in the in the far-reach areas of Narok, where we talk about Loita, we talk about Olokursho, we talk about Oloropil, people who are not able to make it to see the duty bearers in place. And I'll go back to what we talk about when it comes to the right holders. We here, who are the policy makers, who are actually sitting in spaces of power, we need to be able to coin policies that are able to invite the women in, and also actively support male engagement, because we're dealing in a patriarchal society. One of the key issues when it comes to GBV response and prevention is also construction of safe houses. And these are structural infrastructure that are very important for us, because once a woman, a survivor, goes through GBV, then we also need to recognize that beyond the clinical management, beyond the psychosocial management, before we integrate them back to the community, they need a holding ground. And we're looking into the structural interventions that we can put in terms of infrastructure. And then we ask ourselves here, do we have adequate infrastructure to support, whether it's for the care, for the unpaid care and support environment for our community health volunteers, for our women in SOCOs, whether it's for that woman who undergoes GBV in Kareta, do we have the adequate infrastructure in place? And as we look at the policy environment, we also need to be able to invite them in through domesticated policies that are able to work with them, recognizing the societal norms and culture. So,
right. Thanks for sharing that, Audie. We'll be talking about the domesticated policies with Kudeha very shortly. But before that, Mercy, something that Audie said there caught my attention in terms of infrastructure. And the International Labour Organization emphasizes that care is not a cost, but a sustainable investment in societies, and therefore really looking out to really make it clear that this should not be a burden, but it is in fact an investment. So in terms of specific priority areas that constitute a critical investment in the care economy, Audie talks about the need for appropriate infrastructure. But what priority areas would constitute a critical investment in this economy, in this care economy?
Thank you, Lillian. For the last 7 years, we have been implementing a project with International Labour Organization supported by CEDA, and we have been looking at how we can be able to cushion the women from unpaid care work, advancing the discussion of gender equity and equality. And we have been looking at some of the burdens that women bear more, and that is childcare and also household care. Mm-hmm. And when we were implementing the project, we were having workshops where we had trainings for women and also men, but we realized women were not participating in these meetings because they had to take care of household responsibility and travel kilometers away looking for water, like 24 kilometers trying to look for water. And with discussions that we had with the county government as well as CEDA, who is our partner, we were able to put resources because we were implementing a public-private development partnership project. And the project basically emphasized on the importance of all parties to play a part in improving the livelihood of the community. And we were able to put resources together and we were able to implement a project in the community, with the county government contributing 60% and CEDA contributing 40%. And this went a very long way in improving the livelihood of the community, and we saw more women now coming for our meetings. They were able to participate in public participation process and even training, skills training. We are currently rolling out a second phase of the project, and we are looking at how we can be able to strengthen markets so that women and youth can be able to participate. We have identified the tourism sector and the fodder sector, which women participate more, but we realized that the value of the remuneration and also the conditions of women in the tourism sector is pretty low. So we are trying to see how we can be able to even take the skills to the community, where without removing them from the community and their responsibilities of the community. So we are taking the training on the ground. They are trained from there and they are able to get the skills from there. We are also in conversations with the county government as well as investors to see how they can be able to invest in infrastructure that will cushion the women from this burden, so that women can be able to come with their children. They are well taken care of. They are a very conducive environment where they can be left, and also having caregivers who are qualified, who are certified. And this is a conversation we are also having with NITA, so that we can be able to satisfy and professionalize the kind of care services that the caregivers are giving. So that we can be able to be confident to leave our children in the care of caregivers. So these are the conversations we are having. We are also trying to see how we can be able to have markets that have infrastructure that women can be able to come and do their businesses without having to be concerned or worried about the care of their children. Because we recently visited Suswa in Tulele because we were assessing these markets, and we had conversation with women who are working there. They would sit with their children under the sun the whole day. They have nowhere to put their children. Sometimes they would even lose track of their children. You'll find that a woman would lose their child and they will get so distracted. And even their businesses, they're not even able to concentrate. So we are having conversation with the county government, particularly the Department of Gender and the Department of Trade, to see how we can be able to have childcare facilities within the market, the modern markets that are being done by the government. So this is what we are seeing in the second phase of the project, among many other things that we would want to do, because we want to create awareness and challenge some of the social norms that we are having within the community, to challenge also the county government to be able to have conversation within the department themselves so that we can be able to have gender responsive plans and also budgets. So
thanks for that, Mercy. And I'll have you, Mr. Rotich, respond to that. Gender responsive approaches, and we must applaud the county for making important strides in terms of anti-FGM and gender policies, and I know that because I've done a couple of stories on that as well from this county. But what further commitments, just tying to what Mercy has spoken about here, can the county make to strengthen the care economy, particularly for the domestic and community caregivers? We're talking about markets, Mr. Rotich, that don't even have a decent facility for a decent loo, a decent bathroom, a decent toilet, a decent place for the women to discard, their sanitary towels if it is that time of the month. So really a serious problem here. Where are we as regards this gender-sensitive approaches?
Thank you so much. I first want to add to what Marcia said in relation to infrastructural development. Care work can be seen in various sectors. One important thing that we must appreciate, and that has been done by the county government, is the establishment of standalone ECDs. It's an educational venture, but it reduces the time that is spent by parents to take their kids to school and back. Before we established these standalone ECDs, parents would travel 11 kilometers to take their kids to ECD centers and back. But once we established standalone ECDs in the villages, the time that is spent has been reduced. Also, we have ensured that in the markets, we've been able to construct sanitary facilities. And we are establishing markets and establishing at the same time sanitary facilities. And even as we do these, remember Narok is vast, and some of the areas are so remote. But what we are doing is that we are opening the interior through construction of roads and establishment of facilities, health facilities in the interior. We are also using the CHPs, who are actually the workers of the county government, to do sensitization so that we have all our villages open defecation free. That is how the county government has been able to invest in reaching those ends.
Thank you for that. I'll cross over now to Kudeha, but before that, hold that thought. With us, I'd just like to recognize the presence of a representative from Kudeha, and that is Mercy Nyakio, who is here with us. She'll be walking us through what legally is acceptable and unacceptable, and what your rights are as a care worker, what you should be aware of, and we'll be coming to her very shortly on that. And please, once again, just send in your questions. The SMS number is 22422. The hashtag is JK Live at Citizen TV Kenya. Eric, I want to come to you now in terms of the progress on the ground, and particularly in the conservancies, and this really being a tourist hub, I repeat, could you share an example of community or conservation initiative that successfully promotes shared caregiving roles in terms of what we're talking about? You talked to us about being very gender sensitive when it comes to the numbers within the conservancies, women previously never having served as rangers, for example, but looking at progress made even within the tourism sector. What would you say are some of the success stories as regards awareness and where it has gotten us on this International Day of Care and Support?
Yeah, thank you very much, Lillian. Again, and I want to applaud the county government and my colleagues here and their organizations for what they have been able to do. Again, I want to really reiterate that this is not just a government role. It is a responsibility for all of us as institutions and even as individuals. And it starts by recognizing or acknowledging the role that the women and all these other caregivers play in our society. Having said that, in our organization, we work with 25 community conservancies across Narok County, a majority of them in the Mara region, which is, as you say, a huge tourism destination. In these conservancies, we work with about 17,000 landowners who, those 17,000 landowners are all men. But these 17,000 have spouses, so we are talking about another whole constituency of about 30,000 spouses of these landowners of the conservancies. So if the conservancies, for example, have concentrated on just the 17,000 who are the male, then you are doing away with more than three times more of the beneficiaries of conservancies. And so what have we been able to do? Number one is that recognition that as a conservancy, what is the definition of a conservancy? It is the people in there, it is the wildlife in there. So you're looking at what is happening to both of these two pillars, and again, going deeper into understanding, if you are talking about the well-being of this, say for example, community, what are these well-being aspects? So that for us, what we have been able to do is now we have, and I think this is the first landscape in conservation, to develop what we call a monitoring framework. And this monitoring framework brings in all the aspects, both ecological aspects, it brings in social aspects, which basically will be looking at what is happening to the girls, what is happening to women, and what is happening to elephants and lion numbers at the same time. So because we continue to forget and work in isolation as sectors and only concentrate on what we feel matter to us, but there is always a way that some of these aspects, let's say, for example, health for women, there is a way that it has a direct link to the success of conservation, or there is a way that the conservation has, a direct link towards the success of health of that community. We're talking about, for example, human-wildlife conflict issues. Women, those caregivers that we are talking about here, are much more susceptible compared to everybody else. And so what have we been able to do? Number one is providing that recognition so that the women also become part of decision makers in conservancies boards, accessing employment in conservancies, providing targeted trainings to these women, and also just giving them a voice and allowing them to really understand. Again, it's not the role of women to handle, these burdens that we are talking about. Men have a huge contribution that, they also have to contribute, so that this burden is not only left with women, so that it becomes a societal issue. And in conservancies, we have changed the way we look at it so that we don't have women champions. It is men champions in the conservancies that are pushing for employment of girls. It is the men who are pushing for ratification of a child protection policy and so forth. So basically, and then in terms of employment, when we first began pushing conservancies to employ female rangers or, the camps and all those, one of the biggest challenges was the environment where these female rangers can stay, for example. So we piloted, sort of a decent accommodation facility for rangers in a conservancy that we have worked together with the Swedish government and World Vision, and we have sampled a number of conservancies and piloted an accommodation facility that will provide an opportunity for these women to come and they can stay with their children within the conservancy. They can also be able to comfortably deploy their duties because the environment is, is enabling for them. Yeah.
Thank you so much for that, Eric. And now we'll be hearing from Kudehia, and we'll be hearing from Mercy Nyakio. Mercy, from a union perspective, what does decent work look like? Number one, let's really clarify what decent work looks like, because what some people may think is indecent might not actually be indecent for others. So what exactly, from a union perspective, does decent work look like? And for the workers in this sector, in the care sector, what reporting or grieving channels currently exist for either wage violations, for gross violations such as it could even be unpaid leave, it could be lack of maternity leave, it could be lack of leave in itself, which I believe is a fundamental right for these workers. Bring us up to speed with what exactly that looks like from a union perspective.
Thank you so much, Lillian, and I'm so glad to be here. And so I'll start by saying domestic workers or domestic work is one of the oldest occupations, not just in Kenya but in the world. And in Kenya in 2022, we had over 2 million domestic workers working in Kenya. So with this, there's been a lot of employment creation, a lot of economic growth, just because we have domestic workers. But still, this is the one occupation that still suffers or has a lot of deficiencies from them being paid, being underpaid, not being recognized as workers, them going through a lot of harassment and also discrimination. And so decent work, as per the union and also the definition for decent work that should be for the domestic workers, is a domestic worker is supposed to enjoy all the rights of work. And by all rights of work, it means every right that has been stipulated in the laws of Kenya and also international laws, them being able to enjoy social protection, a full coverage of social protection, and also them being able to have a right to be employed easily. So here in Kenya currently, as a union that is representing the domestic workers, we face a lot of, or we receive a lot of issues pertaining the underpayment, and Lillian has mentioned the issues of leave, the issues of them not being able to enjoy maternity leave, the issues of them not being able to be covered by the social protection, which is something that the government is really working on to ensure that every worker in Kenya, be it formal or informal, get to enjoy social protection. But for the domestic workers, we find them not being covered by the social protection, with issues being, first of all, they are not aware of these platforms or of these products, and the bit that the employer is also supposed to contribute part of it, and also the employee part of it, we find that the employers, if they are contributing to it, they have to deduct it. So for a domestic worker who is basically being underpaid, and currently, based on the minimum wage, if you're in a city, any domestic worker working in a city, that is Nairobi, Mombasa, Kisumu, Eldoret, Nakuru, is supposed to be paid 16,711. Now, here in Narok, or a town that was originally called a municipal town, a domestic worker is supposed to be paid 14,866. So you find that someone in Nairobi, so I'll just use Nairobi, which is a city, and you'll find someone paying a domestic worker maybe 6,000. That 6,000 is supposed to cater for someone's rent. Bearing in mind in Nairobi, it's so hard to find a house that is anywhere close to 10,000. That 6,000 is supposed to cater for these domestic workers' children. That is basically taking care of every need in their family and also paying for their school fees. So the moment you mention to this domestic worker to pay for NSSF, to contribute for SHA, and then the employer will say, if I'm paying my bit, I'll also deduct it from your salary. So you'll find the domestic worker opting not to be covered with these social protection services. So for the domestic workers, from all the way, like literally every single right that has been stipulated, and this goes down to them not being recognized as workers. We mostly view domestic workers as people that are just helping, or people that are just like just a casual worker who will come and go, who maybe is on a transit to go somewhere. But most of these people who work at our homes as domestic workers, they are fully they are well able or well trained. Most of these domestic workers are people who have graduated. And because of the issue of maybe lack of employment, they opt to go through now working for someone as a domestic worker. But then we still undervalue them, or we lack to recognize them as workers, and then going back now to facing the indecent pay, the indecent care, or the indecent treatment at homes. And for the issue of, maybe I'll just mention an example of rest or day off. As per the Employment Act, every worker is supposed to enjoy at least 1 day off in 7 days. But for the domestic workers, you'll find an employer telling a domestic worker, you have Sunday as your day off, which is okay because the Employment Act says that the employer has the right to say which day you're supposed to take. But the issue comes in whereby this Sunday you're on off because we are going with you to church. You're the one who will take care of the kids while we are in church. Or we'll go to holidays and you're the one who will take care of the kids. And there's the need of, and which is something that the union has been pushing for, the ratification of C-189. Now, the ratification of Convention C-189, which is on decent work for domestic workers, it's so full on if it's a rest day, let this domestic worker decide how she's supposed to spend, or he's supposed to spend these rest days. Let him or her decide, if I'm staying at home, it's my rest day, so let me choose how I'm supposed to enjoy this day. If I'm supposed to leave, allow me to leave for the 24 hours and I'll be back, which is same thing that is happening to other workers. And so it still goes back to, we need to recognize domestic work as work like any other.
Thank you for that, Mercy. I'll now shift to hear from our live audience, and among us are a number of councillors, and we'd like to hear from one of them that had spoken to us earlier. Please be upstanding as you share with us what one action you think can make caregiving work easier or more valued, even as you share about your experiences interacting with the care workers on the ground.
Thank you, Lily. My name again is Ruth Wanjiro Sipitek, councillor by profession. I would like first to share what we've done as a university to go down there and meet the domestic workers with a collaboration and with an NGO that is World Vision. We've been going to Siginani and we've met those domestic workers through the help of the NGO of Nelly, whereby we talk to them, counsel them, and make sure that those women feel that they are recognized by the university, by empowering them also on how to make money on their own, by educating them on how to make soap and briquettes. And we also educate them on how to love themselves and know that they are recognized in the community. And also they are valuable in the community. Thank you.
Thank you. Thank you for sharing that. Mercy, I'll come to you now from a Forum Civ perspective, talking about civil society and how it can support the county government and indeed the national government to enforce labor standards and improve working conditions for care workers. We had what Mercy spoke about there in terms of the plight of care workers, but in terms of enforcement of labor standards, what needs to be done?
Right. As Forum C, we strive towards creating a just and sustainable world where everyone has the power to effect change. And we start from the grassroots. We help the community to mobilize and prioritize on some of the issues that they have or the challenges that they have as caregivers or as community generally. And they are able to prioritize the issues that they have and develop dialogue platforms where they bring in the various duty bearers and they're able to have a conversation. At the level of duty bearers, we also help them to understand, because some of these leaders that are even brought, like for example the MCAs, they are not really conversant with some of the policies and the legislations that we are having. We create a platform for them to learn and to understand these policies. We also create a platform where they have conversation between the duty bearers and the communities for them to understand. We also champion for the law enforcement, because one of my colleagues has mentioned, there's a gap between the interagency coordination. We are having a challenge here that requires a legal intervention, but there has not been conversation. So we strengthen the interagency conversation by bringing them to a dialogue platform. Mm-hmm. So those are the things that we are doing as Forum C. But one of the most important things is we see how we develop the capacities of the communities to champion these. When it comes to matters of gender inequalities and issues of low reception of SRHR, we bring on board, like my colleagues have mentioned, we bring on board male to champion such things. We bring the community grassroots organization to champion these, because we are more keen on sustainability of these initiatives that we do. Mm-hmm. Because at some point, probably Forum C we will leave, but we desire that we leave a lasting impact and we leave communities having good relationship with their leaders.
Right, thanks for sharing that. I'll now switch over to hear from the men in the audience in terms of how men and what role men can play in sharing care responsibilities. And I think earlier you had some very interesting insights on how that can happen. Please be upstanding. And let's hear from a male perspective on how and what role men can play in sharing care responsibility.
My name is Kenneth Karan, Director, Gender, Equity, Culture, Masai Mara University. My VC has already spoken. So as a university, what we are doing is that, just to mention, number one is that we have students, and most of these students are young mothers. So what we're doing right now is to ensure that we support them, because that is an intersection between education, learning, and also taking care of themselves and taking care of the children. So to take care of these students, what we are doing as a directorate is ensure that we provide psychosocial support. So we are partnering with the counseling section of the university to provide this psychosocial support. So we are meeting these mothers on a monthly basis. Number two, our VC has already mentioned, just to reiterate, that plans are also advanced in terms of proposal development, and I would like to rally partners that we have here to help us establish a daycare center so that our students can be able to come there, leave their children, go to class, have an education, then come back. Number two, even our lactating mothers here at the university can also access the same. Number two, also what men can do is that also we want men to be ambassadors for our women. Like myself, I have an experience working with the girl child, street children for a long time before I came teaching in the university. And what we used to do is to rescue these girls from the street, take them to rehabilitation, and ensure that they get an education and advocate for them. So advocacy support is important. I also want to mention that as a university, the most important thing we can do is research. So the university can also provide empirical data on the statistics in terms of the number of care workers or care economy in general. Mm-hmm. Thank you.
Right, thanks for sharing that. Before I come to Kudeha, from any of the panelists, I'll have any of you respond to this. Is there an actual national database when we talk about care work. And I know, Mercy, we had this conversation earlier, and concerns around the numbers there, whether it would be obsolete or not, or whether, in fact, we do have one. I'll hear from any of you, and maybe, Mercy, because we had this conversation, you can begin, and Eric can jump in.
Yeah, we have the time use survey that was done by the State Department of Gender together with the UN and Kenya Bureau of Statistics, and they were able, it was in 2021, yeah. So I believe the data is obsolete, but I know there are conversations to see how we can be able to do another one in 2026, and I'm really looking forward to that because it will inform the implementation of the national care policy on some of the interventions that we are likely to do.
Yeah, because from 2021 to now, a lot is likely to have happened.
Yeah, sure.
Yeah. Eric, your thoughts on the same?
Not quite sure whether there is a database, but I think what I can say is we benefit a lot from the data that is provided by the government and basically the county government and the Ministry of Health in terms of gender-based violence cases in the county, which is reports that they publish every quarter. Yeah.
And Odi, so there's questions about whether the data presented actually reflects the actual reality on the ground, and I know that you interact with women, gender issues really being the core of what you do. In terms of the numbers that we're seeing with the Kenya Time Use Survey, do you see this being an actual reflection of what is happening on the ground, and not specific to Narok County, but when we look at other counties as well? Mercy here telling me that Northeastern actually has numbers that by far are higher than what we're seeing in Narok County. From what you've interacted with, do you think the numbers represented are a reflection of what is actually happening on the ground?
So first, thank you so much, Lillian. I want to recognize that data that is presented by Kenya Bureau of Statistics is quite valid data, and it's data that you can actually draw a lot of reference. Though considering that our country has gone through a lot. Since 2021, we're just recovering from the COVID-19 pandemic, and a lot in terms of the economic infrastructure has changed. And that means that routinely, as we move into what our life looks like today when it comes to how the economy is running, then we find that the data that we are actually having currently is still being greatly underreported. So we need to be able to look into, going back to what my colleagues and panelists have mentioned, intersectoral and multisectoral coordination, so that we're able to have a database that is hosted by one department that actually is able to inform programming, inform decision making, inform our next steps when it comes to pegging on research, pegging on advocacy. What are some of the items that you can actually pick up and run with when it comes to supporting the unpaid care and support environment?
I'll be coming to you for your individual parting remarks. But before that, Mercy, a lot of questions coming in about reporting channels. If you could clarify that again, for those who feel aggrieved, for those who want to be better informed on what their rights are, how to go about that.
Thank you so much. So currently what is happening, and I'll first speak as a unionist. We have members, so the reporting channel for most of the domestic workers who are members is through the union. As a union, our role is to represent all the workers. That is including the domestic workers. So the first channel that the domestic workers use to report issues is the domestic workers, is the union. So for us, when they report to us, we take it to the Ministry of Labor, and then now if the issue escalates, it goes to the courts. But also what is also happening on the ground is also them reporting to police, them reporting to chiefs. For example, in Mombasa, most of the issues with the migrant domestic workers who are either returned migrant workers or those who are intending to travel. If they have any issues with the agents, they go through the chiefs or the local chiefs that are in the place. So we also have leaders, the Nyumba Kumi initiatives with the leaders in those Nyumba Kumi. We also have people reporting to them. So basically, we have the trade union, we have police, we have local authorities, specifically the chiefs, and we also have now leaders in estates or Nyumba Kumi places. Yeah.
Mm-hmm. Right, and now, viewers, ladies and gentlemen, because we're also taking some questions from our viewers watching us outside of the Masai Mara University throughout, Kenya and diaspora indeed. We invite any pressing question that you may have to forward towards our panelists, or a comment, a contribution, this being the International Day of Care and Support. Please be upstanding, let us know who you are and forward your question. I have I have 3, 4, 5. Okay, I think time allows for 3, but if you make them short, we can take at least 5. So please pass the mic round, and let's be gender sensitive, so that we have an equal number of people contributing. Please tell us your name and forward your brief question or comment.
Thank you. Thank you very much. My name is Muyanga Mudhama. I'm a student here at Masai Mara University, taking communication and journalism, and I think I have a very open question to any of the panelists that we have here, or any expert on the matter. It's already 2025. How far are we from addressing these matters of caregiving to our children, to the old people, to the people who are sick, as a charity matter? So far, it's being left, for all the conversations we are hearing, it's about volunteers, it's someone who's willing to go and do something. Like, can't we take more solid actions towards embracing a more open and rigid way of taking care of these very important people in our society? Thank you very much. That's my question.
Thank you, Mudhama.
Good evening. My name is Jacob Borendo from Masai Mara University. My question goes to all the panelists. With AI transforming almost all sectors, how can it be leveraged rather than it replacing the human touch that actually defines the caregiving? Exactly.
Please repeat your question for clarity. We didn't quite understand you.
Okay. With the transformation of AI to various sectors, how can it be leveraged to transform, rather than it transforming human? How can AI be leveraged rather than it transforming human touch that actually defines caregiving? Yeah.
Okay, for me, it's not a question. It's more of addition or a contribution. We have talked about male engagement, we have talked about social economic empowerment for women, and I just want to mention that for organizations like the Matrust, we have been implementing all those, including the sensitization, the community sensitization, and we usually start with the affected. We don't call them victims. We start with the women who do the unpaid work. We sensitize them on ways to alleviate their unpaid labor, such as we encourage them to engage in microfinance activities, and then they can buy maybe gas cookers and tanks, and then they don't have to go fetch firewood far away from home or go to the rivers and get water. So it lightens the burden for them. So we usually start from there. We also do comprehensive community capacity building, which usually is an ongoing training for a certain community, where we have the men and women in separate trainings, but on the same topics. And that is how we are bringing everybody on board, especially on the unpaid labor.
Thank you for your contribution.
Okay. My name is Steve Onyango, and I have a question. So, how is the government planning to recognize and value the unpaid work care that women out here undergo, and what are the policies that the government has took place to make sure that all the women are working in a good and conducive environment? Thank you.
Thanks for that.
Yeah. Good evening. My name is Anne Lanoi Keton. I teach literature here at Masai Mara University, and tonight I'm interested in children who are able differently, and I'm thinking about mothers who have to drop out from their careers to look at this kind of children, and this means that there will be less income in these homes. The mothers have to spend a lot of time looking at after the children who are born differently. And I'm asking the panelists, especially to the county government of Narok, what measures are they putting in place to help such mothers who have dropped out of their careers to look after the children who are born differently?
Mm-hmm. One last one. Ooh, all right. We're going to take one last question. I'll have the gentleman. Yes.
Thank you, Lily. It's not a question. I am sorry for Nelly Konyo because I know her that she lost her land. When a widow loses land, she will not have a place to take care of the children. My advice to women in Narok and other places of Kenya, when you are married, look for a marriage certificate. Secondly, make sure the land that you own with your husband is registered, either both of you or your husband has the title deed of that land. The law will protect you when the husband will pass away, because the next of kin, as per the law, is your husband. So when the husband is not there, automatically the land will belong to you. Thank you. My name is Kiplakat Serim. I am from the finance department. Thank you.
Okay, well said, Peter. Did you say Peter? Peter Kiplagat. Okay, thanks for sharing that. Empowering the women in the community to insist on a marriage certificate, or at least make sure they have one to avoid eventualities. Now, we're going to be forwarding the questions and comments to our panelists as we get their parting remarks, and I'll just give an overview, a summary of what the questions were. Somebody talked about how far we are in addressing these issues, what solid action has been taken, and that tied to another question, which was what the government is planning to do to recognize care workers. There's also the issue on AI, the introduction of AI and the fact that it is really replacing the human touch, which was a concern for somebody. And finally, a question around mothers with children who are differently abled, mothers who have to stop working to take care of these differently abled children, and how, especially the Narok County government, our hosts today, are cushioning these mothers. I'll start from that end now that there was a question here, and I know ECD has been really a talking point for you, a key talking point for you, but for the differently abled children who cannot be accommodated, or can they be accommodated in these ECDs? Please address that question as I get parting remarks from my panelists as they address each of these individual questions.
Okay, thank you so much. I think my question was specific. And before I answer this question, it's important again for all of us to recognize that care work is actually overburdening women. It's only then that we can work together in the steps of rolling out this policy. So that once we have identified that they are overworked, we can help reduce the amount of work they are engaged in on a daily basis. Number two is on the issue of the PWDs. There is a policy that guides what should be done with children who are able differently. But I think the question was on the empowerment of their parents. It's important to note that this issue is handled by National Council for Persons with Disability. And what they do is that they'll register the parents. They'll register, first of all, the children who are able differently, so that they benefit from cash transfer. Now, once they are registered, they are given a card, and the money will be wired to the phone number of the parents. That is the only way. County government does not do much here. It's a constitutional preserve of the National Council for Persons with Disability. However, we are working with them. We are working with the National Council in the registration of these persons living with disability. We work with them and we have the data. Sometimes it is us who will recommend them to the National Council for Persons with Disability. We recommend them so that they are assisted on our recommendation, so that at the end of the day, we can have all our kids in school, those who are able differently and the others. Thank you.
All right. And to my other panelists, please address those questions or respond to those questions in under a minute as we begin to close. Odi, to you.
Thank you so much. I think I'll respond to more what Mudama Muyanga mentioned, and that was what are we really doing about it? So first, one, we already have within the policy environment, we are looking at a policy that is looking for it to be approved, and that will help us in terms of an enabling environment first, so that we have a structure within which we are working in. And number two, I'm looking at all of us are players at individual level and community level. At community level, we're looking at what the conservancies are doing, putting in child safety protocols, child safeguarding protocols. What are we going to do about our ranger, the women rangers, being out there, who takes care of the child? So we're able to invite people into our child safety protocols. Within our different work areas, Masai Mara is already looking into having a daycare center for teen mothers, for young mothers, and that is so that they're able to concentrate and then they can be shouldered off this. And then we're looking at lactation spaces for all of us who are in power or who are in areas of support. How can we ensure that we have lactation and mother-friendly spaces within our work environment? And to all of us here who have domestic workers, domestic house help, then we go back to what the union states. Are we able to meet the minimum wage to support them? Are we able to look on our leave days so that we're able to capture issues around that? And still going back to the mothers, which I'm really passionate about, lactation and making sure that we have the 6 months period, because currently it's pegged on the 90 calendar days, which is the month. It's still not sufficient for healthy babies.
Right.
So those are areas that we need to look into. So as we move forward into what are some of the issues that we can work to.
Thank you, Odi. To you, Robert. Sorry, Olerasan.
Yeah, I think there is a lot that needs to be done, but we must acknowledge that this is something that is huge, and we need to be able to work closely, and we need to be able to work together, because ideally this is not something that can be addressed in isolation. And this is why we were talking about integrating, leveraging efforts, and talking about and looking at the entire ecosystem. Who are these that can be able to address this particular aspect and the other one? And I think the county government and the government can be that player who coordinates the efforts of all the actors, so that we can try to address this problem, because I think it is so deep, it is big, and it requires a lot of efforts for us to be able to address. But I think the second thing that I would like to say is that it is also very, very important for us to understand our beneficiaries, the people that we support. If you are an institution, you need to understand your ecosystem. There are people, let's say, for example, teenage mothers who may not be able to come to the university. Is there a possibility of taking these trainings to the villages? And so like for example, the people living with disability, how do we make this accessible for them so that we don't develop interventions that can only benefit those who are able, but we are also looking at the entire ecosystem and different profiles within that ecosystem.
Thank you for that, Eric. And finally, Mercy.
Thank you. Just maybe to mention, there's a person who asked about AI, and I just want to mention that care can be direct or indirect. When it's direct, is a caregiver having direct contact with a care receiver. And that one is quite difficult to integrate the aspect of AI, because we are not there yet in terms of having robots taking care of children or elderly people. But again, I must commend the AI because it strengthened the information flow. I can easily go to AI and find if my child is having a situation or an elderly person is having a situation, I can easily get information that would help me care better to that caregiver. And I want to bring in the aspect of climate change, because it's also big. Their weather patterns are really changing right now. We are having prolonged drought. And this is likely to increase the burden of care. So we need to deeply reflect about climate change and seeing how some of these funds that are being channeled to climate change also address the issues of care. And I know that there are money that are being given by development partners for climate change. Let's see how we can bring in the aspect of care in the conversation. And also the education sector. They play a critical role when it comes to challenging the cultural and the social norms and the gender norms. Let us have our children being challenged to address such issues. Let us have our education system working towards having programs that will have more girls taking skills that are more technical, are more engineered so that they can be able to be absorbed in the market. Also, the issue of data, and I'm happy with Masai Mara University. They are working towards having strengthening the data in care, and I really look forward to seeing that being rolled out. Thank you.
Thank you very much for your thoughts. Mercy Koini, Program Officer at Forum CIV, championing gender, equity, inclusion, and policy transformation. Tonight, we're also with Eric Ole Reson, Chief Programs Officer, Masai Mara Conservancies. We're also with Odi Lin, who is a Gender-Based Violence Project Officer, and also with us tonight, Robert Simotro Rotich, CEC for Education, Youth Affairs, and Sports, Gender, Culture, and Social Sciences, Narok County. Masai Mara University has been our host this evening during this very timely conversation happening on the 29th day of October, being the International Day of Care and Support, and truly remarkable insights that we've gathered here today. We thank the VC, Masai Mara University, Professor Penina Olo, for hosting us this evening, and indeed our incredible panelists, and to you for being a wonderful audience. Give yourselves a round of applause. Thank you very much, Masai Mara University. And the message tonight has been clear. It's time we value care work, not just in words, but in wages, in policies, and in respect. And sorry, I forgot to mention Mercy here, Nyekio from Kudeha, really empowering the young men and women out there in care work on their rights and really telling you what the appropriate reporting channels are. Thank you very much, Mercy, for joining us. From us at Citizen TV, we thank you for watching. My name is Lillian Muli. It's been an absolute pleasure. Have a wonderful rest of the evening. Good night.